Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, and welcome to Research Perch. I'm Helen Smith, the Program Manager for Communications, Marketing, and Content for the Massage Therapy Foundation. And I'm here today with Dr. Niki Munk and Sami Zabel to talk about the MassageNet Special Session that happened at the 2025 International Massage Therapy Research Conference that happened this past April in Alexandria. Niki, would you like to introduce yourself?
Hi, thanks, Helen. Thanks for having us. I'm Niki Munk. I am Massage Therapy Foundation trustee member, but I'm also serving as chair of the research committee that houses the MassageNet, which is the practice-based research network that is dedicated specifically to massage therapy and massage therapists. And I am delighted to also introduce and to have Sami Zabel with us. Sami, give a little hi and an introduction for yourself.
Sure. Hi, everybody. I'm really glad to be here. Thanks for having me. I'm finishing up my dissertation at Indiana University as I'm a PhD candidate right now, and I'm also the research coordinator for the Massage Therapy Foundation. I've been working hard for, how long has it been now? Like 4 years on putting together
2021.
and
Yep.
helping get off the ground. So I'm so excited that we are finally getting things put together and ready to go. And we're launching our first MassageNet generated study. So that's what we're going to be talking about today.
So tell me a little bit about everything that occurred at IMTRC 2025. We can
Sure. Well, so let's back up just a smidge and give just a little way high overview of what MassageNet is. So MassageNet is the only large international practice-based research network that is specific to massage therapy and massage clinicians. And what essentially a PBRN, practice-based research network, is a collective of clinicians who are interested in engaging and participating in research. And what the PBRN helps do is solve some challenges that happen around conducting research in practice-based settings. And that typically involves the connection for the researcher to the clinic and practice and patients or clients that are within that practice. And ideally, over time, PBRNs are able to facilitate researchers separate from the PBRN to run and conduct practice-based research within the clinicians that are part of that collective. But ideally, over time, what is welcomed and what is also desired is for the PBRN itself to be able to generate research that is of interest to the clinicians within the practice that reflects their work and that they are engaged and a part of. And we are so excited to share that MassageNet was relaunched in 2022 with the efforts of the Massage Therapy Foundation and the Research Committee. And as Sami alluded to, she was a big part of that relaunch effort and working to put those pieces together. And we've had a couple of external research studies come through and run through the PBRN, but we're extremely thrilled that we were able to have the very first convening of MassageNet members and interested parties to be able to start talking through and talking about the first research study that was derived from our MassageNet members about their practices that will be able to run hopefully starting in early 2026. So Sami, why don't you talk a little bit about how this event actually came to pass? And then I can talk a little bit about in the moment what those objectives were and then what actually happened.
Sure. So for the past year or so, we've been trying to put together this event, trying to figure out how can we get MassageNet members and members of the community to give their input on what kind of things are important to them and their clients in terms of like what populations they see, what kind of conditions are seen in practice, and how could we do that? How can we get people to tell us this is what's important to them? So we decided IMTRC would be the perfect venue for this because there's, you know, a couple of hundred massage therapists all in one place for a whole weekend. So we like, okay, let's bring them all together, and hopefully there will be a whole bunch of MassageNet members there too, so we can bring them in and have their input on what's important to them. So we decided we would have a 3-hour all afternoon session, and we'd have the first part be have a little bit of education about what kind of research we'll be doing and what it kind of means to be a part of this PBRN and how people contribute. And then the second part of it was having a brainstorming session. So what are the things that are important to members and other people in the community, and how can we make a study that will address a question or a problem that is seen in practice. And I think the way we did it, we had poster boards and markers, and we just had people write down what's important to them and what are the problems that are come across in practice relating to these issues. And we narrowed it down to a couple of ideas, and I think we have a really good pool of issues that we can develop a really great study out of. So Niki, do you want to talk a little bit more about that?
Absolutely, yeah. So it was really cool. We absolutely needed to get the input from the stakeholders, but we also recognized some of the inherent challenges of being able to conduct a single research study within several different practices that all practice in different ways, have different ways of documenting, have different ways of interacting with their clients and patients. And so Sami and I did a lot of brainstorming and looking to the literature for different research designs and study designs that would be able to accommodate so many unique attributes of clinicians, clients, and likewise. And so we landed on a design that is an excellent representation for practice-based research. And it's essentially a collective of case reports, which is called a case series, and actually conducting a case series study. And we came up with a really clever way to formulate a question that would allow stakeholders to provide their input on what it was that we would actually be looking at once we helped to puzzle through some of the challenges around data collection. And I'll talk a little bit more about that here in just a moment. So we came up with a research question framework, and I have been told that Helen is going to be able to superimpose this. You don't have to write this down. We'll have this superimposed on this recording here in just a moment.
We can put this in the show notes as well for those who are listening via audio.
Fantastic. Thank you, Helen. So how do massage therapists approach and or treat X in practice, and to what effect? And so essentially what we've done here with this question is we've got two different things that this case series study will be able to look at. First, how it is that massage clinicians treat or approach care for either X population or somebody with X condition. And so what we did with the brainstorming was figure out what that X was later on. And then the second piece that we're doing is we're going to be asking to what effect. And so we're going to have see how massage clinicians are addressing and providing care for a certain population or a certain condition, and then asking the person who received the treatment to what effect that treatment was. So how the effects of that. And so now that we have this framework of a question, we actually puzzled through how we might be able to do some data collection with that. And this effort is partnering with a group called the Result.io. And we had a member of that organization coming and speaking and did a demo with this data collection instrument, which is essentially a really lovely and streamlined opportunity for if a client comes in that meets that criteria and they want to participate in the study that this massage therapist is a part of, that they would simply scan a QR code before they go into the session, answer some really quick questions on their iPhone, or it doesn't have to be an iPhone, on their phone or on a little iPad or something like that, go into the session, receive the treatment, and once they're in the treatment, when the massage clinician comes out, they're actually going to be triggered to be able to do just a quick survey, not a whole lot of time, answering a few questions about what they did during the treatment with that client. And then after that, the client is again nudged to be able to do some another very quick, very fast data collection, again, on their smart device or on an iPad, but they get that through either a text message or through an email. So really quick, really fast, really nice interfacing. So that takes care of the data collection portion for how that would work. So that's all contained them. So that's when the study launches. But now we had to figure out how to make that X and figure out what that X was going to be. So Sami had been working for quite some time with different convening approaches of how to get consensus on different pieces. And so we did a modified open space design of collecting consensus and information, where we had folks divide out into different groups. And then we asked them the question of, what is of interest? What are populations and topics of interest in your practice that we'd like to dive into? We gave them a whole series of questions where they were able to try and narrow down. And one, to get them thinking about, is this a population or a condition that a lot of massage clinicians and MassageNet, one, would be interested in engaging with, and also two, would have opportunity to be a part of. So to have something really, really narrow, a condition or a population that was so narrow that only a handful of massage clinicians would be able to participate in this study, we didn't want something that narrow. And we actually landed on, after a series of, they were going around the room, and we had, once we came up with like the top 12, then we narrowed those down. We had people go and stand in different places to vote. And I think we started with like, I don't know, 20 something different options. And then we condensed them down during a break. And then we wound up with like maybe 6 or 7. But then even during the different round robins and the different circulations, some of those just started going to the wayside as people in the session were brainstorming on things, realizing, oh wait, this is either too narrow, or, whoa, this is so unwieldy, it's not right for this design for right now. Not to say that we wouldn't maybe come back to it.
Do you have some examples of some of the topics that they came up with?
Well, we could tell you that we can go with some of the other topics as well, but I do have the top 4 that we've landed on so far to talk about. But Sami, what's your recollection of what some of those other ones were? Do you know those off the top of your head?
Oh gosh. I mean, there was all kinds of things. Like there was anything from like kids with disabilities, high blood pressure.
COVID trauma.
Yeah. Mm-hmm.
Yeah, that was one of them as well. And some things that were really, really narrow. There were several specific cancer related pieces that were coming up. I think autism came up, or other sort of pediatrics. Pregnancy might have been one that came up.
Yeah.
Depression may have even been one. Mental health, just in general,
there was a couple of mental health related ones, I think.
Yeah. But then once we started peeling away some of those, Helen, We landed on 4 that bubbled to the top as the ones that they then went and had some really nice deep dives into what might be some parameters to consider for these populations or topics, and what might be some challenges and solutions to conducting research in this population. And so if I can have a drum roll, please. The 4 top ones that came out of this were menopause, veterans, of course being very, very wide, massage therapists, which we'll come back to here in just a moment, and then touch deprivation. So these were the top 4 that came out. And what we ultimately had these folks do too is at the end, we had them do a ranking of these 4 after we had pitches and debates and discussions, really interactive, very loud. It was awesome. And it looks like for the group that got the most first place rankings was massage therapists themselves. And they actually had a pretty high second rank. They had also the highest second ranking ones was the massage therapists themselves. This is one that is a little bit challenging to do in the design that we have right now, unless it were, the question was, how do massage clinicians treat and approach other massage therapists in their practice, and to what effect? So that could certainly, but the group at this convening session were really interested in topics deriving and important about massage therapists themselves that actually may lead to another sort of mechanism and another approach that Massage Therapy Foundation may consider around directing a call for some external research to be done in this field. But that's for a later maybe research perch or discussion.
May I jump in real
Yes,
quick?
please.
I would like to point out that one of the reasons why we did this kind of session is because most of the research that's coming out about massage therapy are research questions that are asked by researchers. And we needed to get research questions that are of interest to massage therapists. That's why we asked massage therapists
Right. Yeah.
what is important to them.
Absolutely. And a resounding piece, at least with this group, was about us, which is excellent and absolutely heard. Now, this convening session, I think it was an event that happened at the end of the IMTRC 2025 conference. And so there were a lot of folks that were able to come for the beginning of it, and then they trickled out as people's planes had to catch planes and had to do other pieces. And we started off with I don't know, there may have been as many as 60, 70 people in the room to begin with. And by the end, I think we were down to about 35 or so. Is that accurate, Sami?
Something like that, yeah.
For the very final, I guess I could count the tally votes. I don't have that number in this moment. But this only represents a small sample of massage therapy, MassageNet members or constituents or stakeholders. And we want to broaden this conversation some more to more massage therapists, and to also encourage folks that if they're interested in participating in, when we launch this case study series, if they're interested in launching it within their practice as well, that this is going to be going through MassageNet and for members. So becoming a member of MassageNet to begin with, and then also coming to our next online webinar style convening session, which we have tentatively planned for August 28th, which is a Thursday evening at 7 p.m. Eastern. I say tentative because we are still establishing that platform and making sure that we have all the information for us to have and conduct and facilitate a really robust dialogue to try and define those parameters a little bit more, and also to come to consensus around which topic for now shall we work towards launching in MassageNet in early 2026? Because ultimately, Sami and I need to get working on an IRB which is an institutional ethics review for this to launch, because of course this would be a human subjects research study, and we want to make sure that we have all of the things in place that will be able to not only have this work conducted, but then also to publish it, write it up and publish it. And as another aside, we're also excited to invite MassageNet members who have indicated in their entrance profile that they are interested in being a part of writing or data collecting or data analysis and have those areas of experience or what have you, inviting them to be a part of that actual process in a volunteer capacity with the research committee. So lots of exciting opportunities here for massage clinicians to be a part of research and this very exciting first self-study within MassageNet. Did I miss anything, Sami?
Well, I just wanted to also add, Niki mentioned that this upcoming virtual session is open to all MassageNet members, and I wanted to say that as of, I think it was July the 4th was the last time I checked, we had nearly 900 members registered for MassageNet, and between the beginning of IMTRC on, what was it, April 27th?
Yep, 27th.
I think, and July 4th, we had an increase of 55 members just in that short time. And during the 3 days of IMTRC, 35 members joined. So
that's fantastic.
Yeah,
and
we had a nice jump.
And a reminder too that, we use this term member of MassageNet, and which sort of implies that there's a fee or something like that. There's not. This MassageNet is truly a collective, and wanting to be part of the collective, we do gather a little bit of information about the individuals who are signing up, about their practice and about themselves, so that we know how to let folks know if there's something that may be of interest to them. But this is a collective that is separate from any of the other things that Massage Therapy Foundation or otherwise does that is specific to engagement with research. So we invite any and all massage clinicians or those who are in the massage therapy field or profession in a stakeholder capacity to engage with MassageNet and be a part of this conversation.
You get the opportunity to contribute to research, learn about research, and even get some CEUs, all for the low price of free.
For sure. Helen, did that cover everything? You asked a simple question. Tell us what happened, and then we just went on and on and on.
Yeah, I think you've covered a lot here, and I'm just so excited that people are able to participate. For years, the most frequent question that we got from people was, how do I participate in research? And our donor club used to be called the Massage Matters Research Team, and people would come saying, I want to do research. I want to join the team. And we were like, well, it's not really conducting hands-on research. But now we have that opportunity. Yes. Where we've garnered in 3 years 900 members who are interested in really getting their hands in the game and being a part of things. So it's been really exciting to watch. And if you're on the fence about signing up, it's a simple survey about you and your practice, and there's no obligation to join into any given study. I mean, you get to choose what you want to be a part of. And if you sign up in this next month or so, you can be a part of that August 28th meeting and get to commune with others about your interest and help choose the direction that we're going. So I'm really excited for you guys and everything you're doing.
Thanks, Helen.
Yeah, thank you for coming on today and talking about your work. And I appreciate all that both of you have done over the last 3 years, especially, and the couple of years before that when we were gearing up to do the reboot. So it's really been an incredible amount of work. So we're all very appreciative.
Thank you. And if you would too, in the notes or in the links with this particular Research Perch, go ahead and link up some of those other prior research perches that were about MassageNet for people who want to go and get a little bit of the back history of it. That'd be awesome.
I can do that. Thank you.
All right. Thanks.
All right. Thank you. Bye, everyone.
Thank you.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.